Okay, so we're going to switch gears. I'm happy to field other questions, and you're always welcome to send me an email. We're going to switch gears to David now, and I think we'll go ahead and go for until about 10:35, 10:40, so that you have a sense of time.
Yeah, and I think the plan was I was going to make a few opening comments, but also try to engage both in
Yes.
conversation with both Megan and Phil. And I have to say these presentations are so rich. I'm not exactly even sure where to begin today. Um, but I mean, I do just want to start by saying. Um, I can't think of a better way to start the roundtable by putting the perspective, voice, experience of families front and center. And, I think that's what makes both of these two presentations so powerful. Um, you know, um, it's always, um, both of these presentations remind us, just how diverse and powerful are the experience of families, how those experiences sort of intersect, connect with race and culture and class. And then, also from the perspective of a policymaker, um, policies only work if they work for families, and the only way to know that is actually to hear from and listen to families. Um, so I think that's really powerful. I think what also both these presentations also remind me, is not only is that family experience so important, but also how research, both in qualitative and quantitative research, can be such a really important and powerful tool in helping us understand and navigate what families are experiencing. So just in general, sort of just appreciate that reminder. Um, you know, Listening to both these presentations again from the perspective of policymakers, sort of going back to pre-pandemic and sort of thinking about early care and education. Um, I think we've known that we've both had a sort of a crisis in affordability for parents, but also a crisis in supply. So families can't afford to access early care and education, but even when there's resources available, really challenging to find early care and education that meets families' needs. And, I think that fundamental um, problem of the world of early care and education is clearly that families can't afford it. Programs are barely, at the margins of profitability, and the caregivers are being paid, incredibly low wages. And there's a fundamental economic problem in early care and education that this can't work if it's just being paid for out of the pockets of parents. So I think there's been a really growing and stronger recognition that without some real public investment, not just to offset the cost of early care and education, but really support programs financially to really support supply, we're not going to get out of that problem. Um, this is coming back to the presentations in the sense that, we've really, in the last couple of years, really been trying to sort of develop more explicit strategies to support the supply of early care and education. And I remember having one conversation with a legislator about 18 months ago of, well, how will you know when there's enough supply? And I can't remember if I actually said this or my thought was, we are so far away from that I'm not really worried about answering that question now. But then when we got into the middle, when the pandemic hit, we were suddenly in this situation, where everything changed overnight, and programs were shut down and then operating under new emergency childcare guidelines. Parents were told to stay home and not go to work, but that wasn't reality for a lot of families. And then we were really in the situation where trying to sort of figure out where we were in the relationship between what was available childcare and what families were sort of needing immediately under those situations became really, we were really, to be honest, operating in the dark. And, while we were able to assess what was the sort of available, emergency childcare supply, really having a sense of what parents were needing and demanding in terms of childcare in those situations was really, really challenging. And I think remains a really significant challenge. But I think what both of these studies also do is complicate the just even how you assess demand and adequate supply, right? So we can count numbers of programs, we can count numbers of slots, but if it's not affordable to families, if it doesn't operate during the hours that they need, if it doesn't meet language needs, if the family doesn't feel welcomed and comfortable in the program, then it's not meeting demand and there's not adequate supply. So I think I think both of these studies really help us in complicating those questions. Listening to Phil's, I think part of what was so powerful in Phil's presentation was really just the straight line it creates between material stress, caregiver stress, and child stress. I think it also just really powerfully highlighted how the pandemic has just magnified and worsened existing inequities and inequalities associated with race and income in a really powerful way. It also sort of brought up, though, the way some of the sources of social resilience and the way of which social networks also really play a role in supporting families through some of these difficult situations. So one of the things I actually ended up thinking a little bit about in hearing Phil's presentation, there was some really interesting research by Mario Small from about 10 years ago about the way in which childcare programs actually provide a really important role in helping parents develop social networks and social capital. So there was something I hadn't really, so I think it was just made me think about how the pandemic's also impacting that indirectly through the way that it's impacting childcare. It was also really powerful, and I hadn't heard the recent results until this morning from the study on how parents are thinking about childcare. But just that parents are returning to childcare, but having that ongoing concerns about safety was also really quite powerful. And it just reminded me, when we were working on the guidelines under COVID-19 and did a survey of parents, there was just one quote from a parent in one of those surveys that I just couldn't get out of my head. And there was just a parent who wrote, I'm scared to put my child back in childcare. I have to work. I don't know what to do. Just the challenge that parents are sort of facing in this current situation. It's something we just have to, can't forget how real those struggles are for parents of sort of navigating both the sort of safety concerns, but the reality of needing to work and access care. But I think that also brings home just how important it is to sort of have that deeper understanding that you can only get from directly from hearing from families of both what does it mean for them to feel safe in a program? What are the supports that they need to be present, to have that kind of at least greater sense of trust as you're returning their kids back to care. And sort of similarly sort of thinking, how has the pandemic changed what parents, or has it, in terms of what kinds of care arrangements that they're looking for and what they're looking for when they're making those choices, knowing that those choices are often really constrained by both availability but also just financial resources of, of families. So anyway, so those are some of the reactions, and I just sort of want to turn it back to both Megan and Phil, if you have any sort of follow-ups.
I can share one piece around the resilience in terms of the role that providers are playing in supporting families right now, as well as the role that the CCR&Rs are playing in supporting the providers who are supporting the families, was really stood out in the interviews. The amount of consideration for helping families apply for a program, for helping them understand the processes. There's a lot of an invisible, I think providers often felt like they're doing kind of this behind the scenes support. And I think acknowledging that that was something that really stood out to us as a really a key thing to recognize in terms of when we look to increase support and we look to help continue the childcare system of who are parents speaking to and really getting good information from, and then if they're trusting their providers, then how do we support those providers in the role that they're taking on that goes beyond childcare?
Megan?
Yes.
Yeah, this is Nadia Lucci, SDA6 again. And hi. So, just to add to that, sometimes it's really challenging for CCR&Rs to, I'm speaking for experience as a bilingual person trying to help, either non-speaking providers or even English-speaking providers. But, one of the biggest challenges that sometimes add to the stress for providers and therefore to parents and kids is the huge lack of bilingual trainings that we have. Sometimes as CCR staff, we're given this training in English, and we are expected to perform it in Spanish or Russian, or but we're not given the tools, or we're giving the training but not the script in the language. So that means while you're teaching, you have to translate at the same time. So the quality of the product definitely, is lower. I would, to say it easier. And I think that adds to the stress as well, because if we have good trainings for the CCR&Rs, therefore the providers are well trained, the ones that, don't speak English, and therefore they feel more confident going through this, navigating this. Parents have all the information as well, and children, therefore, they benefit from all that, So it's really worrisome when, I think sometimes we have to start with that, making it equitable somewhere. We have to start somewhere so that the steps that are below or that are coming after, they're equitable as well.
Great. Yeah, that's very helpful to hear. And yes, I mean, there's definitely this need for support across multiple levels, and recognition of how challenging it is to translate. There's a lot of translation and making things fit for a family. And I don't just mean translation in terms of the language. So thank you for sharing that. That's very helpful to hear.
And I think we're also already hearing the sort of strong connections between today's focus and the focus for the next section of the roundtable.
Yes, definitely doing some foreshadowing for Thursday. Stick around. I see a lot of wonderful questions in the chat. I'm trying to multitask here around the challenges, around that it feels like between a rock and a hard place from the parent perspective. I see the comment from Margie around going back into childcare and dealing with when a kid gets sick. There's and managing the ups and downs and the fears and other issues, and also a recognition from Shannon Vanda Hay around the role of safety in childcare, and how safety has continued to be a concern. Before COVID, that was very much people have been concerned around safety and health, and so I appreciate those comments, and I'll definitely take a closer look.
Can I just add one thing on safety? I think what's also important to call out here is, not only is this something that we're hearing from families, when we were also surveying providers during the pandemic, that was also a front and center concern from providers themselves, right? I mean, that was the number one concern about reopening, was also safety for themselves, for their staff, but also the children and families in their program.
Great. Let's finish up with one more question. I see a question in the chat from Mary around the current and potential role of incentives for people that have irregular scheduling needs. And I'm not able to speak to that, but I don't know if other folks are able to speak to that challenge, and how you're thinking about helping families meet those needs.
And I'm wondering if there's any of our colleagues from ODHS online, because I know there was, was something that there was some work to sort of piloting, within employment-related daycare. So I don't know if there's anything anyone from ODHS wanted to add on that.
Hi, David. This is Jen Eras with ODHS Childcare Policy, and we did do a pilot paying an additional amount for alternative hours, which were anywhere from evening care to early morning care, as well as weekends. And we do think it was very successful. It just wasn't something that we were able to maintain funding wise for long term. So and there's still a lot of work to do to gather information about the types of schedules that our families are currently working in. That's something that our current system doesn't have the capability of tracking metrics as far as what their work schedules are. And so we just really got to see the amount of use of both our providers and our families, like how many of them were actually utilizing and accessing that alternative hour care.
Great. Thank you, Jen. Yeah, it's a big need. There was one provider that we spoke to that participated in that incentive program, and appraised it very highly, and felt and not only shared that it helped financially, but that it felt like it was a recognition of the work that the provider is doing, that they were going above and beyond, and so yeah, it again was well received, at least by the single person.
I have a question for Jen. Jen, do you believe that providers who would not have provided irregular hour care chose to do so because of the incentive? Do you think you actually increased the availability?
Without having, oh, sorry, go ahead, Bobby.
That's all.
Just without having that baseline of knowing how many of our providers were already doing that type of care, we didn't really have a way of being able to tell if we were just helping the families that were already on the program and that were already participating in that, or if we were actually doing anything to increase the supply. And a lot of our providers are family, friend, and neighbor care, and so they're not in, the NACRAWare databases as far as the hours that they're providing or anything along those lines.
Yeah, a lot of potential next steps around that. Thank you, Jen and Bobby. Okay, so I see a couple other questions. Let's ask this one final question and then we'll take a short break while we organize breakout rooms. Please stick around and join. We will do that right before that. David, I don't know if this is something you can address. I know there's not a single answer, and maybe Phil also, but is there a sense of how many providers have left the business during this pandemic? And how are you wrestling with that question?
Oh, thank you that's a huge question. And something we are really wrestling with, and would love to get input on. I think there's sort of two parts of that question. One is, I don't know if we're still so in the middle of, so I think what we clearly know is the financial impact, the stress of already programs that were operating at the financial margin has been so huge that it has been really challenging for programs to stay open. We were able to, through some of the federal resources, to direct some resources to help programs with the financial strains, but the resources were, we know are not at the scale that is needed to address that. At this point, I would say that we don't have a great sense of who is planning to reopen, over the long time, who is planning to stay shut. I also don't know if we're, when are we able to say that we're sort of more in a more sort of permanent state to a sort of assess, I think has also just been one of the, I know my assumptions in March about, when we were going to sort of be in recovery mode were so completely off base in terms of timing. So I think that's, the other challenge is to sort of know when we're sort of in that place. But I do think that we are needing to sort of start to sort of look at that. And we sort of had initial conversation of like, at least how do we start mining licensing data to get a little bit more sense of what we're seeing in terms of those long patterns. Again, I think we're going to actually have to go back directly to providers and ask, I think is going to be also part of that. So I think it's the top question that I think we all have is sort of what's going to be the sort of long-term impact on supply, but also really not just at a top level, but really digging into, types of care and at the community levels. So I wish I both had a good answer to that and a good way of answering that. And we will also
I definitely toss that to you because there's not a good answer is my understanding. David, can you take this one? Yeah, thank you. Yeah, I remember planning for this meeting and saying like, okay, so we'll be talking about recovery. And then like a few weeks ago, having this realization of like, no, we are still, we're in the depths of this right now. And so it's hard to get your bearings and hard to know because realities are changing and we don't know. So that's always fun, especially when you're a researcher and you like to know and define. Okay, so thank you all so much. we are now going to take a quick screen break. Please take some time. We're way off our schedule, which I expected, but I'm happy that there is a lot going on. If we didn't get to what you're writing in the chat in here, know that we will. This is definitely wonderful information to have, and we are excited to see so much action going on there.